I have a history of migraines, but in the last 3 weeks I've been getting pain in my temples and that feels like a toothache. I am so confused because I can't figure out what kind of headaches they are. Do you think it could be my teeth or maybe my sinuses? You can hear a clicking sound when I open my mouth. I've been told that my jaw is out of place. I went to the dentist 1 month ago and told them I was getting throbbing in my temples and having toothache pain, but they checked me and said that I do not have any cavities at all. They did mention I need to get my gums cleaned out because the gums are sinking down, so could it be from that maybe? Some people say that you can get infection so bad it can go into the area of the brain. It is true. The most common type of headache to affect one or both temples is tension headache. Most people with a history of migraine headaches also experience episodic tension headaches. Headaches may be caused by dental and sinus conditions. Dental conditions include temporomandibular joint dysfunction, also referred to as TMJ disorder. The articulation between the temporal bone of the skull and the lower jawbone is referred to as the TMJ. The movement of the two bones, the joint, can be abnormal on one or both sides, due to arthritis of the joint, torn cartilage within the joint, or excessive clenching or grinding of the teeth. The latter is referred to as bruxism. Bruxism may be voluntary or involuntary. The involuntary form usually occurs during sleep. Headaches caused by TMJ disorder may be on one or both sides and are usually localized to the temples. In contrast, a headache caused by an infected tooth or sinus is restricted to the side of the infection. Sinus infections are usually over the cheek, adjacent to the nose, or over the forehead. The temple is usually not the only location involved. Yes, dental and sinus infections may spread to the brain to cause a brain abscess or meningitis, neither of which are suggested by your description. It sounds like you should ask your dentist to check your bite alignment. Just because you hear a click doesn't mean anything is wrong with either temporomandibular joint. If the possibility of TMJ disorder exists, according to your dentist, he or she could refer you to someone specializing in diagnosis and treatment of that condition.